Okay, is it clear, Susi?
Yes, sir.
Okay, Bismillah Rahman Rahim. I'm Asad Yousuf, and my topic of today's is Care Path, Step Toward the Paperless Environment. This is my disclosure statement, and I have no relationship with any vendor or marketing or reselling. So the question is why we want a paperless environment. So this slide is self-explanatory that we want to put our own data in the systems, and we want to reduce the use of the paper, which of course deforesting will be reduced, and we can hopefully get this motto. The second thing is our hospital working on electronic health system. It may start in 2022 in AQH Karachi, and we want to integrate our system with EHR so that we are not supposed to feed the information twice on both the system. So this is a general overview of my presentation would be. So I'll be talking about a TG262, our department workflow, ARIA as a workflow and communication manager, Care Path, step toward the paperless, and the challenges. So what's the expectation from the participant? They may be able to understand the ARIA oncology system, able to make Care Path for their department workflow if they are using the ARIA or variant systems. So basically WPM TG262 was published, and in 2021, it's a guideline for the vendors so that they could design the system in such a way that radiation oncology department can go with a paperless environment. So they'll talk about the administration, design, electronic charting, and communication. And this is what the workflow of radiation oncology start with the simulation, external beam planning and delivery, and brachytherapy planning, clinical processes and billing. And this is what we want in paperless stuff. And we expect the vendor to provide the facility which can cover all these requirements of WPM TG262. The biggest challenge, of course, get all the documents in the systems. So this is the RT workflow in AQH Karachi, and most of the hospitals have same settings. So start with the clinics, MDT tumor board, RT decision, simulation request form, and then we'll go to the till the end. There's a follow-up. So what I want to show you in this slide is this blue highlighted is still in our department. It's in a hard form. And the green highlighted is including both recorded in the system and also in the hard form. And the orange one is only the things which are electronically done. So we need all these things in both in a record system. We don't want to keep hard copies, and we don't want to keep only the soft copies. So we want all the stuff in the soft one. ARIA is a communication and information system. It allows us to prescribe the patient, prescription can be done, treatment plan can be done, and they are integrated to each other. The treatment history maintains, and the journal, which allow us to put the notes, and the QA of the chart can be done within a system. So this is an interface I believe all of you are familiar with. On the patient booking, once the patient was decided to be treated in a radiation therapy department, our receptionist do the registration process of the patient, and he put the stuff in the registration bar, and our existing system can push the data in our system so that it can get the demographic of the patient and addresses and everything. The important thing in this that we have to put the primary physician, we have to select the primary physician so that physician can track his patient along the care path. The next thing is diagnosis. This is a very good tool available in ARIA, and it allows us to put the diagnosis of the patient, the staging, pathology, lesion, and it gives the protocol as well, the codes. And if you maintain the registry, cancer registry, you can get, in the end, you can get the data from the ARIA system in a form of report. Sorry. Okay, the journal notes. This interface allow you to put the notes, whatever you want to write in the confidential files, you can directly write in the notes form. And you can see that the first one is the CT note, the simulation note, or any patient instruction that staff have to follow. We can put this thing here. So this can be maintained, and this can, if you are keeping a hard copy as well, then you can print this as well. The chart QA, where you can get all the summary of the patient. Again, the chart QA, the treatment, how the treatment goes on. If there is any problem arises during the treatment, it will show up here in the chart QA. In the graph form, you also can get in the graph form. Reports. So there are generic reports available in ARIA, and you can print it out. You can check these reports, and it's quite useful. We used to have this report, task completed and due date, and for the care path. And the last is summary. So this is what ARIA, and the last, another thing is prescription. This is a very important tool. You can do the electronic prescription on the system, and this is also the requirement of TG262, that the vendor system must allow you to write the electronic prescription, and this prescription must have the interlocks as well. Means that if the prescription was changed during the treatment course, then it will automatically unapprove the plan and prompt the physicist to change the prescription. If the plan was attached to the prescription, then this will happen, and you have to assure by the doing quality assurance of the system. Now let's talk about the care path. What's the care path do for us? It basically a communication system between the physicist, physician, and RTT. So in order to explain the care path, I have to post sharing, and I have to share another window so that you can understand how care path works. So now I am starting to tell you about, is it visible to all of you?
No, sir.
Okay, एक minute. Now it's visible?
Yes, sir.
Okay. So this is a home screen, and one have to understand what are the tools available in the home screen and what are the tabs available, so that you could use these tabs appropriately. So on the left, you have two task and appointment. These are the activities. At ARIA, two activities are available, task or appointment. The task is associated with the person who have to complete the task, physicist, doctor, or RTT, whereas the appointment is associated with the patient. So the patient present is important in appointment. So that's the difference between these two. Then there are other tabs. It's available, pending, in progress. So it related to the appointment or the task as well. So what is available right now under the group of oncologists, there is no available task. So, but if you change the range, the data range, then you will get, you will see that there are some tasks available. For example, if I put 10 or 10, so you find one task is available, and there is a 4 patient under it. So and then pending, if there are any pending, there are 26 pending approval or in progress. There's no in progress, whereas there are some of them are completed. So this is the window, and this is here where you can change the group. You can see the groups. We have a oncologist group, physics group, peer group, or you can see the individual person or the machines. So in this way, you will toggle around this home screen and you will find what you're looking for. Now let's talk about the care path. So I have selected to explain this interface. I have select the patient triple Z test, and I already appointment scheduling is already done. And here you can see in the visual care path window, you see that was scheduled for the CT, and there is a pre-sim checklist attached with that CT. And now I'm going to attach the care path. These are the available care path right now, and I will attach the test care path for this session. So what's the date is 25, so I will attach in 25. This window will appear and you have to edit this window. Here you can see the first task is attached with the resident group and the primary physician. And this is a due date and this is the time. So you just have to click OK if all the information is OK. And the care path is attached. So the first task is TNM staging. So the resident has to complete this, or either doctor can complete this. So once the care path is attached, you have to schedule, and you have to select the second activity, the schedule and dependent activities. Okay. And you can see the reds, that is it's already overdue due to the time. Here there is a LAN, care path LAN. So the first care path LAN tell you that this is belongs to physician workshop. The second LAN is for the planning. The third LAN is treatment QA and the pre-treatment task. So now let's go back to the home screen to see how it works. So in the resident group, you may found this patient. Here is a patient. So triple Z is available. And in order to follow the care path, you have to click the TNM staging, the task. This is a task. So you just click the task and it will take you to the diagnose window. Here you are in the diagnose window. You have to fill it up. The resident will fill up all this stuff according to the patient disease, and it will click the done. So that task is complete. Now as you've seen, the other task is import image. So this is now complete in the care path, and now this is ready. This sign shows you this is available. So now we will go to the import image and import the image here, CT or MRI or whatever you have to import. Then you just click the done and it will complete. Now it's available for contouring. In a similar manner, we'll click on the task and it will go to the tab, contouring tab, where you have to contour the patient and you can complete the patient easily. And then again, you have to complete the task by clicking the done from the above taskbar. Or if it is already done, then you can complete from here as well. It is done now. So now the ball is go to the oncologist part. It is now removed from the resident area. So here you can find the patient triple Z is available for the PTV approval. So now the physician have to complete the patient. So whatever the PTV is there, you should complete the PTV, and then you can complete by clicking the done. It is available for the prescription now, and now we'll see the prescription window here. So I want to tell you about the prescription template. Here you can make the template as well. You can manage the templates so that you can directly click the template, and all the doses are filled according to your department policies or protocol that usually doctor used to follow. So for example, if I attach brain, so it will appear here, everything is filled automatically. Or you can change manually. Brachytherapy prescription can also be right. Electron prescription can also be written here. And you can select the energy. So whatever you filled, it will goes to the Eclipse, and the physicist can attach that prescription, and everything will be attached automatically. And this is what the prescription is, and these are the guidelines if you want to put for the doctors. If the doctors want to put any guideline for the physicists, they can put here. So you need to understand this thoroughly, and physician can approve the prescription, and he is the only one who can unapprove the prescription. If you want to review the prescription, he can. If he want to error out something, then he can click on error out, and he can change the prescription during the course of the treatment as well. And as I told you that the system will unapprove automatically the patient, and the physicists have to complete again, replan or just change the dose, and treatment may approve again. So once the prescription part task is done, then you have to done this thing. Now it will go to the again we can check that how many tasks are done. Now it will go to the peer review. So the peer review is basically the physicians sit together and review the volume, and if there is any changes they suggest, the primary physician will incorporate that thing, and then it was complete. So you can also complete the task from here, and the care path you can easily complete that task. It can be done. So if you go back, and now the ball in the bucket of the physics part, and you can see the physics got the patient here. So let's go the IMRT planning, and now it will take you directly to the Eclipse. And here you can plan the patient, and also in the care path you can attach the checklist. The checklist which you used to fill in a hard along the file, you put any hard checklist, and you can put the soft checklist in the Eclipse or in any part of the task. Like in diagnosis, you can put the checklist. In prescription, if you like to put any checklist, you can put it, or in any tab you can put the checklist. So once the checklist is there, then you have to complete that checklist. You can't remain incomplete. It will not allow you to done the patient. Like if you click the done, then of course it will appear checklist. So you have to complete that checklist. For example, I will complete this and save, and now I can done this. So it will now it is completed, and it will now appear in the planning approval. Okay, the physics part is complete. Okay, the checklist is okay, complete now. The planning approval. Now the plan is gone to the bucket of the doctors. So again, the doctor have to now we have to go back to the oncologist group to see. Here is a planning approval. If I go to the planning approval, I don't know whether, okay, there's no checklist. Okay, there is an option, and I will tell you later when I go to the administration part, then I will tell you that in the doctor's part, you can put the like decision making option is there, that if the physician does not like the plan, he can ask the physicist with the help of ARIA, he can ask the physicist that you have to replan the patient without any communication, telephonic communication. You can convey the message through ARIA system. So this is how it's done. Uh, Now, if I not complete the task from done and I'll click here, it will ask you whether the task is complete or you have to put leave in the progress. So I like to put in leave in the progress. So the patient will not appear here and I have to check the patient in progress patient. Here is the patient is there. Now I'll complete this patient and it will now go to the double check. One thing I have missed, in the past, the system is that the file comes from the simulation and the RTT staff used to write on the board to let a physicist know that there's a file. Then we switch to the Excel sheet and they just write the description of the patient on their Excel sheet and it will appear on our system. And now we are moving towards the care path. So in the care path, the one physicist was assigned who's responsible to assign the patient to other physicists. So how he going to assign the patient? It is quite simple. He come to the care path and it will go to the edit and he can add the patient here. So if I open again, for example, I assign the double check. In a similar way, you can assign the planner as well. So you can add the staff from here. Any staff who was assigned for this plan can be added from here. So for example, I want a double check from Mr. Zaim Ahmed. So I will put it, and this will appear in the Zaim Ahmed group. So the patient is appearing for the double check. So Zaim have to do the double check. Again, in a double check, there is a checklist and he has to complete the checklist. If a bolus is not attached, you can do not applicable. If there is no ISO center shift, it's not applicable then. Save and done. So now this task is complete and can complete again. Okay. Now the file delivered to the unit, and from here you can assign the unit as well. So the unit staff will get know directly that there is a patient on their machine. So you can attach the machine. So the patient was assigned for TrueBeam 4. So now the RTTs knows that there is a patient, there is a file of the patient available for their unit. And on RTQA, again, there is a similar checklist is there and they have to complete the checklist. There are many ways to create the care path. You can develop the care path according to your requirement, whatever your requirement and what your department requirement is. Another thing I want to tell you that there is a lag time between all these tasks. Here you can see it was started from 25th Monday and the delivery date is 1st of November. So there are, how many days are there? Approximately 7 days available here, I believe. 1, 2, 3, 4, 5, 6. 6 days are available for this task. So there is a time limit is attached and you can change the time limit and you can change the time limit for each task in the administration part. Okay, now I will go to the administration side and to let you know that how we can develop the care path. And for this, the participant must have the rights of the data administration. Those who have data administration right, it is a good learning opportunity for them. So here, first of all, you have to create the activity and codes. So here we have an activity and codes. For example, I will check the planning approval. So double click on it. And here you get this kind of window where you have to select whether it is appointment or the task. And then activity category, name, description, status, and what are the resources or the group associated with this activity. Escalation group. Other than that, then care path lane you have to attach with this. And this is a planning approval, and as I told you that planning approval is associated with the decision activity as well. So you can select the decision activity here. If you click this, then physician has a right to cancel the care path and ask physicist to replan or whatever his requirement is, and he can put the note as well on that from the patient. I forgot to tell you that there is an option of putting the notes. Here in edit, you can put notes, whatever you like to. Okay. And in every task, there is a availability of note. So this is the first window. The second one is association. This is how it works. As we click the task, it will go to directly to that task, that tab. Like if you doing a contouring, then it will directly go to the contouring tab. If you're going to diagnosis, it will directly go to the diagnosis. Here you associate that activity with the tab. So you just edit and you select the activity, and then you can add that activity. So edit 3D planning, so it will go to the Eclipse. If you select 2D planning, then it will go to the plan parameter, and vice versa. So here you can attach the tab associated with the activity, and here you can edit the checklist. So this is a checklist I already made, and you just have to add this if you want to put checklist on that activity or task. This part we are missing right now. We have to learn about this questionnaires part. Associated task is if there is an appointment, we can attach the associated task with the appointment. Like for example, for the CT, we have attached the pre-sim check. So there is a checklist was attached with the CT. The RTT has to fill. So that's the associated task. So once you have prepared all your activities, and here you can make the checklist, you can new, and you can whatever you would like to add, you can add whatever the question you want to make, you can easily made here. And there's a long checklist I've already made, which can be utilized. So this is the activity part. And now I'm going to care path. So here you can add as many as like care path you want to add. So you just have to select new, name them, and you can start with that. So for example, I'll create for you test 2, and just have to select the. So now this is the window is appear, and now you have to drag and drop activity. Just follow the instruction. So add activity. So we are talking about planning task, and we want to start with, for example, contouring, and auto assign oncologist was checked. So activity was add now, and add another activity. For example, planning and PTV approval, and just have to select this. It's okay. And now again add. So, task. Primary planning. You can attach primary physician with that, but this is not a requirement. The physics group is attached with that. Okay. And now you just have to attach. Simple. If you want to detect, just delete. It will detect. If you want to add, you just add it. Whatever you want to do like that. And if you want to delete the activity, if you're not happy with that, you just delete it. And once you create this kind of thing, and you have to attach with any patient, and you can check that activity. The other care path we do have is the phase 2 or electron boost. This is for the RTT site, and they can directly attach that with the patient, and physics group will get the information that there is a electron boost or phase 2 is carrying. So there is no they're not supposed to come to the TPS to deliver the file. Physicist staff can ask the file to come, and the information can be conveyed via this care path system. So the other stuff are ad hoc tasks. These are the tasks can be attached in care path for the messages kind of thing. So it can be ask doctor to complete the patient early at your earliest, complete the peer review, or patient specific QA can be ad hoc task for the physicist. He can schedule the patient specific QA, and it will appear on the physics group. Or there is anything which you would like to ask for the doctors, this can be done with the help of ad hoc task. These are some papers for the references, and you can follow these papers. The challenges main challenge is ARIA integration and connectivity with our EHR system. E-document and customized document are the option we are looking for, so that whatever the document we are maintaining in the hard, we can put those documents in the system, and then we can directly fill up those documents within a system, and that help us a lot. So what TG262 survey said, the electronic task-based workflow is difficult to use and often ignored by the physician. The simplification and ongoing education is needed. So once you create this kind of care path activity, you have to follow rigorously with all the staff. You have to bring all the staff into one table, and you have to educate them. You have to well, there is a lot of work on the background. So thank you very much for listening, and thank you very much for joining, and I'll be happy to answer your queries. This is all from my side. Yes, Unaza.
Thank you so much, sir, for such an informative session. We have a question from a participant. How we can add and approve the checklist to the task or with the appointment attached?
Can you repeat the question again?
How we can add and approve the checklist to the task or with the appointment attached?
Okay, I have showed you the checklist. There is no approval need for the checklist. If the checklist is associated with the task, then you have to complete that checklist. Other than that, and the task will not be completed. And other than appointment is concerned, then appointment it directly linked to the checklist. It has to be linked with the checklist. If it is attached, then you have to complete it. And I already showed you that how to complete the checklist.
Thank you so much, sir. That's all from the question answers chat box.
You can unmute the participant if they want to ask
Sure.
any question.
Hello, Asad.
Ji?
Yes, sir.
I was waiting for this moment so that I
Oh,
can unmute.
welcome, Raincore.
First of all, thank you so much for reminding us this, because we did this long time ago. And now the first question is, have you implemented this paperless environment there?
Have you?
You have started there implementing this whole paperless?
Yeah, we
Are you
started
using
we started the care path. We are following that, and now we are not following any Excel sheet or board. But the proper paperless is not started yet. We are lacking of some licenses we are looking for. Hopefully we'll get an end of the year, then we will be completely paperless.
Yeah, the reason I'm asking is that what about, you know, the JCIA point of view, from the auditor's point of view, because currently we are, of course, on the files, they have to check everything on the file. So does it need any separate approval from our quality department to implement this, to fulfill the requirements from the JCIA point of view?
Well, we will learn this thing next year, I believe, when the EHR will come.
Yeah, this was the question, because I'm hesitant to implement this here. The part of the reason is
Nairobi, it was established in Nairobi, EHR?
No, we are still working with the EHR team.
Okay.
This is the question. I don't know how to incorporate regarding from the quality audit point of view.
Okay.
Because, you know, you have a limited users for the ARIA and this care path. The external auditor cannot come and check you, right? So
no, actually we want an integrated system. Whatever we put in the ARIA, it will go directly to the EHR. This is what we want. So we are not supposed to feed the information twice on both the system.
Oh, all right. So it will be accessible to anyone, you mean?
Yes. ARIA is not accessible, but the information will be accessible.
Oh, okay.
For the ARIA, they need a system, of course.
All right. Now, just to give you a clinical scenario, for example, you have put some, double checks and the pre-checks, pre-treatment checks. If someone has not done the pre-treatment checks and the still patient has been treated, and if something happens wrong, and if you are going to do the RCA,
then there is a record.
will come. Then how you are going to...
There is a record in the report. Each and everything is stored in the report.
Okay.
From the report, you can dig out anything easily. Or if there is no template for that, then you can ask vendor to customize the report for you.
No, what I'm saying, the auditors will still be depending on you, right? You will be showing the information to them. They cannot do the independent audit.
Yeah, I think yes.
That will become biased, they can be biased.
Well, inshallah, in near future, we'll see that, how it will work.
All right. Okay, let us know so that we can also see how we can go about it.
Okay.
Thank you.
Welcome. I see the Asad Zamir raise the hand. Is there any question from you, Asad? Okay, Onaza, we'll wind up this session.
Sure, sir.
Yes, Asad.
Yes.
Sorry, at that time I was on mute. Right now I unmuted that I can hear and listen to you.
Okay. Do you have any question?
I have very short and small question. First of all, that was very informative and good presentations, because nowadays mostly people in the world are going to be a paperless. So we must try for it. It's very good efforts. We have Mosaic here in our institute. And in
Yes.
Mosaic, we have these all options that we mentioned in your presentations. Like we can scheduling the patients. Only one question regarding your presentation I have. Uh, what do you think when you scheduling the patient,
Mhm.
you give timing, suppose 11 to 12 to one patient, but
Yes.
patient come after 1 o'clock, 2 o'clock. Then
Okay.
do you have this option to do the amendment for this particular patient? One question. And other question is, as you mentioned in your presentation, we can give this information to the patient. Suppose during this scheduling, we have some problems or errors with machines, and due to some interruptions, we can't treat the patients. So we need to note and mention in the brief history or in a note paragraph. Then what do you think? It will be good to share with the patients or not? Or what kind of information we need to share with the patient? Because when we scheduling a patient according to Mosaic, because we have a Mosaic, then when we click the command print, then it give us all the documents regarding or related to that particular patient.
Okay. In ARIA, we have appointment scheduling stuff, and it was done by the UR receptionist. So
Okay.
if patient came late, it doesn't matter. We can accommodate easily, and there's no like no hurdle for accommodating that patient later on.
That's a great. Yeah, that's great.
And then so the second one, if there is any interruption on the machine, then of course we have to convey the patient by communication. If the patient is arrived, then we have to obviously apologize and make them wait. If machine can be start soon, if not, then of course we have to return the patient, of course. And we document that thing on the appointment scheduling about the cancellation of the patient.
Oh.
We not
Okay.
only document, right now we are documenting twice. We are documenting in the system, ARIA system as well, and we are also documenting on the confidential files.
Okay. One last thing. Suppose
Yes.
you are going to be a paperless,
Hmm.
and suppose someone asks us what regulations and what guidelines you are following, because to prove the paperless, we must follow some guidelines. Is there any guideline?
Right now, the guideline is made for the vendor side, WPM TG 262. For the radiation oncology perspective, there is a guideline of TG 201, electronic charting.
Okay.
So we have to follow that one.
Okay, Asad, thank you.
You're welcome.
Khatam?
Yes, Uneza, you just it's up to you.
Yes, sir. Thank you everyone for joining today. Inshallah, we will be joining tomorrow for the next talk of Sir Abdul Qadir about applicator QA and treatment planning in brachytherapy. Inshallah, see you tomorrow. Thank you everyone.